I'm with Dr. Vivek Nangia, a very well-known pulmonologist at Fortis Hospital here in New Delhi, and I'm going to speak to him and ask him the questions that we are all asking in our minds about COVID-19, the coronavirus health scare that we are confronting these days. Dr. Nangia, welcome to The Print.
Thank you for having me.
My first question to you is about the statistics. 3 people have died, or this is what we know so far. About 150 people have been infected across the country. What can you tell us about the state that India is in today vis-a-vis this emergency?
See, this new novel coronavirus that we are facing today these days has basically emerged from China. If we go by the statistics which have come from the Chinese studies, of a study of about 72,000 patients, 80% of them had a very mild to moderate illness. It was 20% who actually turned to be serious, out of which 5% landed up in the ICU. The case fatality rate of this illness is only about 2 to 3%, depending on different studies that have emerged, 2 to 3%. So one is that we should not panic from it. Okay. We should be ready to face it. There are certain precautionary steps that one should be taking and preventing and protecting our own cells. So as far as the figures in India are concerned, we have the figures that are being released every day. And also there has been a random study that has been conducted by ICMR, which says that we are still in that phase of epidemic where we can still contain it effectively.
So tell us a little bit about this study. What did ICMR do exactly? ICMR, which is the Indian Council for Medical Research.
That's right.
So what did it do?
So my information is just as much as yours would be, that it's all from the media and the newspapers only, because I don't work with the governments. I'm only in a private sector hospital confined to my own patients and my own hospital working. But whatever I have read so far, they say that they checked it randomly in some 5,000 odd people or 500 odd people. 500 odd people, and they were all negative so far. So according to them, there's still not any community spread happening. It's only confined to the travelers and their contacts. So we're still in stage 2 of the epidemic yet.
What does that mean? What does stage 2 mean?
So they're basically different stages. Stage 1 would be when it is only the travelers who have come from foreign land carrying that virus are infected. Okay. Stage 2 would be when their contacts are getting affected. Therefore, its contact tracing is very, very important. Stage 3 would be when it starts spreading in the community, where I don't think we've reached yet as per the ICMR study and as per the ICMR statements. So we're still in stage 2 as per them. And stage 4 is when it's an epidemic in the country.
Which is what happened in China and is happening in Italy and in France and other parts of Europe. So you're saying India is between stage 2 and stage 3. So how does it move from stage 2 to stage 3?
If it starts spreading in the community, so I think this is where our social responsibility comes into play. Our duty towards the nation comes into play, where if we have traveled anywhere abroad recently, then it's very essential that we self-quarantine ourselves. In fact, there are some of my friends, my own niece, who's come back from abroad. You know, these children were all studying outside, somebody in London, somebody in the US. So all of them have come back, and all of them I've ensured are right now under self-quarantine for the next 2 weeks. Okay. That's very, very essential.
And you think that could help?
That is the only way. So, you know, instead, stages 1 and 2, all you can do is, 1, containment of the disease. Right. Containment would happen, 1, by identifying the patients early, then contact tracing them, meaning tracing all their contacts and also quarantining them, whether they have the disease or not. And 3rd would be by spreading awareness about it, you know. And then second stage comes as where you need to push the peak of the epidemic further. Right. See, basically what does that mean? That basically means that if you have, say, about 1 lakh people who are likely to get affected, so 1 lakh people getting affected in 1 month or 1 lakh people getting affected over 6 months, they're 2 different things altogether. When you have 1 lakh people getting affected in, say, 1 month, that means there's a lot of pressure on the healthcare services. Yes. Then the services being extended to them would be of very poor quality, and the mortality rate would be very high. Right. Whereas if the same number of people were to fall sick because of any illness over, say, 6 months, you're able to provide them better care, you're able to provide care to their families, their extended families as well. So the chances of the mortality rates come down significantly.
So this is what you would call flattening?
Flattening of the epidemic curve, where you're able to push the peak as much as you can.
And that is what India should do right now?
Absolutely.
And that's what we
are trying to do right now. Okay. By quarantining ourselves, by tracing the contacts, by cough etiquettes, personal hygiene, hand washing, all of those measures. And also we need to look after the vulnerables. So we need to identify which is the highly vulnerable lot. The highly vulnerable lot would be those who are elders, more than 65, 70 years of age, or those who have an underlying uncontrolled diabetes, heart disease, bronchial asthma, COPD, liver disease, cancers, anybody who has any other form of immunosuppression like AIDS, HIV. So this is the highly vulnerable group.
Right.
We need to look after them very, very well. More important also is social distancing.
Yeah.
You know, we
a
need
phrase
to.
that we hear all the time these days.
So again, you know, this is something that we need to start implementing it with immediate effect.
So what does that mean exactly?
Social distancing basically means that this virus basically is spreading through droplets, right? Now, when it is spreading through droplets, that means if somebody is coughing and sneezing in the open environment, it is likely to be contracted by somebody who's standing close to this individual, and then he's likely to suffer from the same illness. This virus is a large virus. It's only gets transmitted till about 6 feet. So if you maintain a distance of 6 feet between two individuals, especially from an individual who has a cough and cold, then the transmission of the disease is like to be lesser.
But anybody who has a cough and cold doesn't mean that this person has the virus.
No, certainly not. But I think this is also the right time to spread the message that there is something called cough etiquette, which actually means that when you have a cough and cold yourself, first of all, wear a mask.
Yeah.
Quarantine yourself anyway, even if it is a common flu. You know, after all, flu also has a fatality.
Right.
There is a mortality associated with common cold and common flu as well.
So how many days should anybody with a cough and cold?
So with a simple cough and cold, 7 to 10 days.
As long as that?
Yes, definitely.
Okay.
So you should, because in any case, even if you see that the course of it's a 5-day course that we give to our patients who suffer with swine flu, influenza. That's also like a common flu only.
Right.
So 5 days and another 3 to 5 days, because the viral shedding continues, that is the time when they should be self-quarantining themselves. Self-quarantining is also important because if there's any viral illness, it totally devastates your immune system.
Right.
So you become more prone to catching infection from others. So after you recover from your illness, your immune system is still recovering from the original infection.
Sure.
And that is a time when there's a lot of pressure on the immune system. And we should try and avoid exposure to others so that we don't catch another infection, which can be really serious subsequently.
Right. So, doctor, there are these reports that from Jaipur, 2 patients were treated with anti-HIV drugs, the antiretroviral drugs, and that they were cured. What does that mean?
So there are various theories behind it. This is a virus which is very novel in its origin. We still don't know much about it. The virus is still being studied. There are certain.
Do we know how it started?
So this basically started from that Wuhan live animal market, where it was it's a recombinant virus which has undergone certain recombination in the bat species along with one other species of which we are not sure. And then it spilled over into the human beings from the bat, in that market into the human beings.
Do we know whether it's a bat or it's a reptile or something?
Yeah, so it was a combination of a bat and a reptile.
I see.
It's a recombination that the virus has undergone in the bat and one more reptile, which we are not sure of. Okay. At least as far as I know, we are not sure of that yet.
Right.
And then it has spilled over from them into the humans, and now it is spreading human to human.
Okay, and this has happened before with SARS.
That's right. That was also from the bats.
So this is the second time that a virus is...
Or was SARS from probably the birds or something.
Yeah.
But anyway, that also came from the animals, yes.
So this is the second time that it has jumped species?
Not second time. There are several such viruses.
Okay.
MRSA came from the camels, then
yes, that's right.
Zika, Nipah, Ebola, they've all come. HIV, it's come from the chimpanzees. So all these viruses, which are actually turning out to be fatal to the mankind, have actually come from the animals.
So to come back to the Jaipur patients, how did they recover after being administered?
So basically there are studies which have shown that the virus may have certain similarity with the HIV virus. In any case, we have a limited 8 to 10 antiviral drugs. So what most clinicians are doing, just trying them out rampantly to see if they work or not work. So it's like, you know, even otherwise patient might have recovered on their own. We can't be certain.
Okay.
So there is, because this is just one patient, you know, 1 or 2 patients. Just based on 2 patients, you can't claim that this is the drug which has cured it.
Right.
Unless there is a proper randomized control study, which is not possible in the current circumstances. But in any case, as I said, 80% of the patients would recover on their own also, with or without any antiviral treatment.
Okay. That's the good.
But again, ICMR has approved the usage of anti-HIV drugs in patients who have a serious illness.
Okay.
Having said that.
So do we have enough anti-HIV drugs in the country?
Yeah, of course. I would feel so,
So
yes.
there's no fear on that front.
I wouldn't
there's
feel
no
so,
scare
yes.
on that front. So now coming to the way that China dealt with the epidemic, and then from China, and today we've seen that the Chinese seemed to have controlled it, that for the second day they've only reported 1 or 2 cases in Wuhan or in Hubei province. But my question is also with Italy, which has reported several score deaths on a daily basis. So what happens? How does it travel from China to Italy to Iran to South Korea? How did that happen?
So I think only with the travelers. I am not an epidemiologist, so I really wouldn't know the details of it. But as my understanding goes, it's only through travelers only. It's not that it's originated de novo in Italy. It is through the travelers.
So it was people who came in and then
Absolutely.
They infected the local population.
Because there's a huge asymptomatic carrier stage also, which means that the patients, the individuals, I would not call them patients, but the individuals may be carrying the viruses in their upper respiratory tract, nose, oral cavity, mucosa, and may not be showing symptoms of the disease yet.
So explain this word asymptomatic. What does that mean?
Asymptomatic means that there is no symptoms, and yet the individual is carrying the virus inside.
So that could happen to any of us in India?
Absolutely. And that happens, we are carrying so many other viruses also. This would just be one of them. So if you actually take a swab, if you take a swab from your oral cavity and get it tested, you will find a list of viruses and bacteria which are like present there. They're called the normal flora of the body.
Okay.
That is why human bite is considered to be more dangerous than an animal bite.
I see.
So you need to take anti-rabies vaccine if a human bites you actually.
So lots of things we are learning. But doctor, tell me, the WHO chief, Dr. Tedros, has in this very sort of evocative phrase said, test, test, test. But you said earlier that ICMR is not doing this.
No, ICMR is doing whatever is required. I think government is taking very proactive measures right now to control the epidemic as quickly as possible. They have been, I think, ahead of times in declaring the,
ahead of the curve.
Ahead of the curve, much ahead of the curve. And we are hoping that we are able to tide over it without much of an issue.
But why are some people saying that testing in India isn't required? Just because WHO is saying this doesn't mean that...
See, I'm sure government is taking the opinion of the best minds in the country available.
Right.
So I'm sure they're doing what they need to do. If you see, WHO has actually applauded the country's efforts also, based on the ICMR report of 500 random samples which turned out to be negative.
Is that too small a sample?
As I said, I'm not an epidemiologist, so I really wouldn't know. I'm more into clinical care of patients.
Right. So just a few last questions, doctor. What about young people? Is it, could they be much more asymptomatic than middle-aged people?
So on
like
the contrary, what they've shown in that study from China is that in 0 to 20 years of age group, there were only about 2% or less than that patients, and hardly any mortality in that group. Most of the mortality that has happened is in the elders and those with an underlying illness. So these
what you call
comorbidities. So this is the vulnerable group, and again, it's the uncontrolled state of illness, meaning that if the diabetes, the sugars are still fluctuating, remaining very high, asthma is not properly controlled, heart disease, they're not taking their proper medication, and blood pressure is remaining high. So these would be the patients who would be more vulnerable. So it's time to bring all their pre-morbid illnesses also under control.
So
seek proper medical advice for that.
Right. So 2 questions. One is that we are getting into the summer. Temperatures will rise. Do you think this might help in controlling the epidemic?
So there is no study so far yet that is available to say that, in a higher temperature the virus may not be able to survive. So we really don't know how things would be in summers.
You don't know that?
No, we don't know that.
So we could be living through this for the next
Because the disease is happening in Australia, Thailand, Vietnam, not Vietnam, but Dubai. Australia and Thailand, where it's relatively warmer.
So we should be prepared to live through this for the next few months?
Let's see. I think the next 2 weeks will tell us how things shape up finally.
Why are you looking at 2 weeks?
Because the way the epidemic is, if we're able to control it in the next 2 weeks, then hopefully things should not worsen.
And the last question is about density, especially in big cities and the metros. We all live very closely together.
Yeah, sure. So social distancing is all that we can do about it. Avoid overcrowded places, avoid public transports as much as possible. Schools, colleges have already been shut, cinema halls are shut. Most of the clubs, night clubs, bars, everything has been shut down. So I think that's a very, very good move, a very proactive step by the governments to control the disease.
Now, people are also prescribing a lot of home remedies, everything from Gaumutra to alcohol to hot water.
People may be prescribing, but I don't think the government of India is prescribing anymore. If you go by their guidelines, I think this is a time where we need to strictly follow the guidelines that are being issued by the government. After all, as I said, they've used the best minds to formulate those guidelines, and those guidelines don't mention anything about any homeopathic or Ayurvedic medication which could be used for this purpose.
And the next 2 weeks are critical.
Absolutely.
Dr. Nangia, thank you so much for speaking to The Print.
Thank you.
This is Jyoti Malhotra for The Print. Please continue to watch our YouTube channel. It's live and buzzing.